writing a lot about it. He has been talking a lot about it, and he has done a wonderful job in coming out with protocols and guidelines as far as medical education and healthcare is concerned. So over to the chairpersons, Dr. N.K. Singh and Dr. R.L. Agarwal for the next session. Dr. N.K. Singh, please take over.
Thank you, Dr. Birmani. I think as Dr. Birmani has just introduced Dr. Professor Dr. Vitull Kumar Gupta, I have 1 week ago, I had some interactions with him. As Dr. Birmani truly said that he is the man, he is a illuminating mind, and his writings are really excellent. So many times we see his writings in the many newspapers and something innovative coming from his mind. So I think as Dr. Birmani rightly told, with that these days, I think the turmoil is going on, that lots of things are changing. We are not sure what is happening in the right direction, what is happening in the wrong direction. And we have seen all the problems with the healthcare, which in the second wave, it was so much criticized all over the world. But still, I find that just now, even at the Texas, the 2 days back, there was no oxygen and lots of problem was there. In the US also, I think I think this is a very unique topic Dr. Birmani has kept, medical education and healthcare. As he is a human rights activist and consultant, Kisori Ram Hospital and Diabetes Care Center, Bathinda, Punjab. I have great pleasure with my co-chairman, Dr. R.L. Agarwal, to welcome you, sir. And please start your sharing and your talk. Thank you, sir.
Thank you, Dr. N.K. Singh, for nice words. I must congratulate and appreciate Dr. Birmani for keeping this rather very important topic for discussion and sharing the session with Dr. N.K. Singh and respected Dr. R.K. Agarwal. So this topic is really passionate to me because I think status of medical education decides the status of healthcare system. And please excuse me if I overshoot the time for 2-3 minutes. My disclosures are I am narrating my actual experiences and observations with reference to some references and media coverages. Some might not agree with me about the pathetic state of medical education. I think they have not been exposed to the actualities of the prevailing condition, as some of my senior people in administration as well as famous faculty of medical colleges expressed surprise on my observations during my interactions. There is no conflict of interest. And when we talk, the expression is like this, unbelievable. This is happening in medical education. Mind you, my friends, for next few minutes, we are going to see what is really happening in medical education. As India is aspiring for an exciting new future of growth and progress, medical education gains immense importance, expected to play a crucial role in overall development of the nation, and more importantly, provide competent, ethical, and efficient doctors. Medical education system in India is one of the largest in the world, confronted with challenges, problems, controversies, crawling on rough paths towards an uncertain future that may have adverse impact on healthcare system. The problems which we are facing today were not that problems 40 years back when we were students. So it is more important to discuss the challenges today rather than it would have been 40 years back. Medical education in India is at crossroads, maybe on the verge of collapse. Some people may not agree with me, but when we discuss the medical education status, then they will come to agree with me. Post COVID-19, everyone, including professional organizations, the media, is becoming more and more sensitive about role of medical education, except the government and National Medical Commission. We have great write-ups about the importance of medical education and providing doctors in numbers as well as ethical doctors. Challenges in medical education is the main topic today, and medical education is facing numerous challenges, each requiring days of discussion, but we are going to discuss a rather few challenges today. Some people might think the challenges in the term of digitalization, curriculum change, communication, PPP model, but I think all these are also important, but more important challenges are those affect the psyche and conduct of our doctor and environment of medical colleges, especially the private medical colleges. Rapid and uneven growth of regional imbalances of medical colleges is creating a great problem. Regional imbalances is thought to be because of political patronage and commercial concerns rather than quality of medical education ably supported by the government. So government is fueling this regional imbalances. Commercialization and privatization of medical colleges is another important aspect. In 1990s, medical education reform made it easy to open private medical colleges, prompting commercialization with concept of buying medical seats rather than merit, leading to skyrocketing capitation fee and corruption in admission. And you will find the sequential flow of events in media that from 2009 to 2019, lot has been done to promote privatization and commercialization of medical education rather than strengthening the public medical education. Private medical education, even after establishment of NMC in 2020, remains very expensive and has become a market investment for rich. When NMC was promulgated, it was concept given by the NMC that it is going to regulate 50% of seats, fee in 50% of seats in private medical colleges. And you know, everyone knows how much fee is regulated by NMC today. So you get media reports of increasing the fee that is going to be beyond the reach of a common man. And we are doing our bit to enforce the fee regulation even in private medical colleges, but it is very difficult to fight the system which is out to promote commercialization and privatization. Commercialization of education has affected the mentality of young students, making them more materialistic, self-centered, without value of sacrifice or service, and affected the chance of poor, brilliant students to become a doctor. Cultivation of commercial rather than ethical environment in private medical colleges has led to complete eradication of societal and humanitarian aspect of medical education, converting it in a very lucrative business. On the other hand, there is a miserable neglect of public healthcare institutions confronting with low budgets, inferior infrastructure, unable to keep up with the pace of new developments in medical science. Numerous AIMs have been opened mindlessly. Before that, the concept was very good because government has somehow thought to invest in public health care. But almost all are facing one or the other problems today. And more importantly, there is no separate budget for medical education. It is just included in the health budget. So if you see the teachers gap, almost 50% vacancies are there in AIMS. Corruption in medical education has different faces depending upon private or public medical education. The worst kind of gross corruption and open corruption, I must say here, and unethical practices was and are encountered during previously MCI, now NMC inspections, when bus loads of patients are mobilized to fill up empty wards, car loads of doctors are paraded before the inspectors, and you won't believe now there are contractors to provide the junior residents and senior residents in bulk. You want 100 doctors, 100 senior residents, they will be provided by the contractor. Birth and death registers are being manipulated. Instruments are hired or shifted between the colleges, and still the private medical colleges manage to get NMC or MCI permissions under the influence of cash, kind, or political patronage. Same things are happening now under NMC. Reports suggest that in spite of qualifying exams, many private medical colleges charge under the table in addition to high fee for admissions. Worst type of corruption is passing the undeserving students, especially with gross deficient attendance in lieu of cash and kind, and this is being openly done. There is contract to pass in private medical colleges. What I am talking is some private medical colleges, not all. Several other aspects of corruption practices we can't discuss because of constraint of time. And this is how the media is reacting. How inspections are fixed. The ghost faculty, the Punjab Medical Council chief takes on the minister, but he failed to do anything. And these are the media reports, and these are the actual things which are happening in private medical colleges, empty wards, rented patients. You see the patients are on a picnic in the medical ward. The files are there, ghost files for ghost patients, the empty registers, and role of universities and colleges. Universities and colleges play an important role in grooming young students, but the present commercial environment and rote learning continues without any consideration of academic excellence, even if the curriculum change has occurred. But still the same rote learning is continuing because they are not investing into change in curriculum. Professional ethics based on Hippocratic oath has been replaced by business ethics. And now on Teachers' Day, I must reiterate that our teachers influenced our psyche without any curriculum to taught us ethics. But now, even if the curriculum changes there, in business environment, you will not be able to teach the young students of professional ethics. There is rapid proliferation of institutions with deemed university status, grossly deficient in infrastructure, manpower, and merely serving the commercial venues for giving degrees. When institutions thriving on illegal and unethical practices, how on earth anyone can think that such institutions will able to provide a good ethical and academic institution? So that is my main idea of challenges in medical education is. So such institutions are caught charging money from insured patients. And most importantly, role of regulator like NMC or state medical councils. Role of regulators are most important in maintaining standards of medical education. Unfortunately, since inception of MCI in 1934 and replacement by NMC in 2019, the role of regulators, including the state medical councils, have been questioned by all. MCI was plagued by corruption and was dissolved in 2010 following arrest of MCI president by CBI for accepting bribe from a private medical college. And after that also you will find numerous media reports of exposure of private medical colleges, fake facilities, increasing illegal or unethical practices. Parliamentary Standing Committee on Health and Family Welfare submitted its report in 2016 and found MCI hugely responsible for prevailing pathetic state of healthcare, low standards of medical education, and promotion of corporatization. But presently also, the functioning of NMC has been questioned by activists like me because of personal experiences of fighting against illegal and unethical practices, because it has failed in its objective for which MCI was dissolved. And when MCI was dissolved, there were huge protests questioning the status as well as functioning of MCI by the largest body and most prestigious body, Indian Medical Association. But even after formation of NMC, private medical colleges still continue to charge obnoxiously high fee, get advance information about NMC inspections, stage manage the drama of inspections, compromising the list in admissions with progressive lowering of question marks, qualifying marks, failure to initiate inquiry against private medical college in spite of written complaints as well as visual proofs. So again, media reports of high medical fee, leaving many docs in debt trap. And so now you cannot think a poor student can get a medical education. A steep hike in medical education left Punjab grappling with shortage of doctors. Salary barely covers the loan EMI. And I think in a desperate effort for increasing medical seats, NMC is promising on quality of medical education, compromising on quality rather than increasing quantity of medical students. Skewed distribution of medical colleges, seriously compromising teaching and learning activities, monitoring standards of admission, evaluation, faculties and teachers are inadequate. Projects like converting 75 district hospitals and medical colleges, as well as relaxing norms for opening private medical colleges, the faculty requirements adds to the problem faced by medical education. From where we are going to get medical faculty? This is the larger question. The NMC bill was supposed to be a positive step. Only time will tell how positive it can be for benefit of medical education. State medical councils have been only doing registration of doctors and awarding CNERs and failed to enforce ethical practices or curb quackery. More importantly, NMC is just a recommendatory, issuing guidelines and advisories, but can't enforce. And these are the advisories to medical colleges to take PG examinations before, but when some students complained that the colleges is not taking exam because of some reasons, allegedly, the NMC replied that they can't interfere in the university working and they can only advise. And you all know how the advice is followed. In commercial interest, I think nobody is following the advisories. So these are the, again, newspaper reports of PG students at the university demanding early final exam. Private medical college collect 1.5 crores from MBBS students for issuing NOC. The Baba Farid University of Health Sciences moves NMC for alleging foul play. And what NMC is doing? NMC is just issuing an advisory. What about the 1.5 crores? They should be reimbursed to the students. Only then we could have think that NMC is going to make some effect. NMC is the worst system failure because in spite of honest, credible and efficient doctors heading all the NMC boards, nothing has changed. If you see the profile, all the good respected in medical profession are heading the board. Private medical education mafia is thriving under the so-called watchful eye of NMC, and I feel NMC is helpless in this highly corrupt and commercialized system. Even after 2 years of written complaints to Punjab Medical Council and NMC and previously to MCI against a local private medical college, I just failed to receive any response whatsoever. Curriculum revision is a welcome step, but what use it will be when there is contract to pass system? Does the curriculum change matter? So this is how the students are going to write the papers. Splenomegaly of the liver, severe burns is angina pectoris, arteries and veins are causing atrial fibrillation, and this is how a student is checking blood pressure in final exam. Poor internship supervision is again a concern. The present system depends upon entrance tests for PGs and DM courses, forcing them to join coaching institutes, and that is compromising the internship training. Moreover, less number of PGs compromise compared to UG seats will leave half of the doctors, which will be untrained, ill-trained to practice as primary care physicians in future. So again, NMC is drafting guidelines. Every 2 years, we are having a separate set of guidelines and students are confused what to do. Shortage of clinical material, it is dangerous situation because it is failure of NMC to act even after written complaints, and colleges are going to have fake and ghost rented patients, and that is compromising on training of the students. Poor research activities. Most of the medical colleges add medical sciences and research to their name for administrative reasons, but about 57% of medical institutes don't have a single publication in 10 years. Why do medical institutions produce so much? Because it is a worrying aspect that we are not having any research in medical institutes, and this exposes whole of the scenario. Only 3-4 institutes, good institutes, public institutes are producing research papers. Even when NMC requirement publication exists for promotion of faculty, we are not having any research activity. But in absence of any credit for research in selection of PG or DM courses, discourage doctors to go for research rather than they spend time attending coaching classes for entrance exam. Selection of medical students, when NEET was introduced, we thought it is a revolutionary step going for a long way to rationalize medical college admissions and almost eliminate capitation fee, but it has miserably failed in its objects because privatization, the colleges has increased their official fee to match capitation fee, that is 50 to 60 lakh for a course. NEET results of 2018 reveal that decrease in qualifying cutoff marks has opened doors for candidates with just 18 to 20% marks to get admission. And scams are again, recently Madhya Pradesh has encountered a medical exam scam, and from 0 to less than in NEET paper can get admission. So it is rich and powerful with poor marks are getting admission for medical students. And there are numerous newspaper reports exposing such things. Shortage of medical teachers continue to plague medical education system and getting worse with rapid proliferation of medical colleges. The easy way out for colleges is to employ ghost faculty, pay them less, and go for NMC criteria. And teachers gap, we have already discussed, it is more than 50% in public institutes also. So my dear friends, to sum up, public institutions face challenges related to lack of funds, infrastructure, poor work environment, and bureaucratic control. And private institution, miserable failure of NMC and law enforcing agencies, excessive commercialization, increased illegal and unethical practices. So what happens? Why we are discussing impact on healthcare? So student is entering into healthcare system. That is product of medical education is going to man the healthcare system. And under the hypnotizing influence of market economy, medical education is producing doctors with changed ethical and moral standards. Patients are consumers. Healthcare delivery is a business. Ethos of profit in this new lucrative medical industrial complex where professional ethics are being generally abandoned. And such a transition is leading to intrinsic polarization. Public sector is for non-profit preventive healthcare. Private sector is profiting for curative healthcare, and research is influenced by profits rather than real needs. As Dr. Anuj has made a comment that more research is going on in diabetes rather than in hypertension, because hypertension, the companies think it is not profitable. Market forces are controlling the management decisions, not the needs of healthcare system. And during COVID pandemic, decay and decaying of healthcare sector was exposed like never before. Private healthcare was found enjoying complete impunity and has devised innovative methods to exploit helpless patients. And you will find such reports from Kanyakumari to Kashmir that private hospitals charge and fleecing the patients. And we had did a bit. And when you find a health minister visiting a hospital against whom several complaints are made, how on earth you can think that that health department is going to take action against that hospital? Despite raids, the private hospital continue to fleece patients. And even our finance minister has written an article that pandemic has laid bare the flaws in healthcare, and still we are doing nothing about it. And we did a little bit to provide free COVID treatment in our hospital, and still the government did not give us permission for 12 days and gave permission to at least 500 private beds. So that exposes the government that doesn't want the free treatment to be promoted and favored the private hospitals. Present statistics prove that India has a long way to go before it can achieve universal health care for all. Our healthcare system is becoming insensitive, inequitable, unaffordable, apathic to societal needs, and we need to reform our medical education system if we want our healthcare system to progress. As some wise person has said, corrupting education system is going to destroy a nation, and corrupting medical education is going to destroy national healthcare system. COVID pandemic should provide our policymakers a wake-up call for drastic medical education reforms, strengthening the public health care, including public medical education, by spending at least 3.5% of GDP. Now we are spending only 1%. What is required? A comprehensive consideration of issues plaguing medical education to evolve solutions implemented in short term, intermediate and long term to make education sensitive to societal needs. I must compliment ACP API Joint Conference and Dr. Anil Kumar Vermani and his team for discussing this rather important and very passionate issue, which some will say I am presenting a negative view, but in fact it is the reality, believe it or not. And if we are going to escape reality, walk away from reality, nothing is going to happen. So question being asked are who will apply the brakes? Is there some time to stop, reverse, and most importantly, is there a political will to do? Whenever I do the lecture, people ask me what next, what solution it is. So medical education should find a prime place. No one has right to commodify it. So there will be always a tussle between private and public, but we need to involve a India unique system where private as well as public can thrive, can progress together without affecting the professional ethics of medical profession. Destroying education is going to destroy a nation. Destroying medical education is going to destroy the national healthcare system. So, my dear friends, with this, I thank Dr. Anil Kumar Vermani and invite all of you to Mapicon Bathinda 2021, that is from 16 to 19 September. Thanks a lot, and I request you do raise your voice for medical reforms, and whenever you find some deficiency, you must document it. Thank you very much.
Uh, Thank you very much. Very illuminating talk. It was an eye opener for me and for, I think, all of the members. And I think all will agree that whatever issues you raised, very few people are raising. And we are most of are keeping mum. All the realities which you showed, I think there is no debate on that at all. But I will ask before my co-chairman tells something, that what are the solutions can you have some 10-point solution or some that will we will be happy to learn from you. Do you have any solution for that?
So question is to me?
Yeah,
Solution is until and unless, see, when MCI was there, it was wrong to dissolve MCI. If some institution is not working good, we should reform that institution. We should put ethical people in that institution and trying to address that. But we did not do anything, and the government did not listen to the medical fraternity. And we have NMC. So mind you, until and unless NMC is going to take strong action. See, you cannot post a policeman to everybody's house for protection. It is the fear of law. If there is fear of law, fear of NMC, that NMC is going to come and disqualify the doctors for 10 years for ghost faculty, or de-recognize the institution for 10 years for having the rented patients, ghost faculty, or illegal and unethical practices, I think half of the thing will be done. So these are the immediate measures where the NMC has to be proactive. So if NMC, why NMC is not proactive? Because they are not funded adequately. They did not have manpower to go and inspect surprise inspections. So in our local medical college, they get a prior information 10 days before that NMC inspection is going to occur. So I inform NMC people in writing that these people have got the information that on this and this day inspection is going to occur. Nothing is going to happen. So that will encourage the private hospital to go in for illegal, unethical practices, make money, and share the profit. It is profit sharing. So they make money, they share it with, sometimes it is cash, sometimes it is kind, or sometimes it is political patronage. So that is how they are occurring. So immediate measures is NMC has to be proactive. We need to invest in medical education. We need to give our, on Teachers' Day, I request the government to increase the pay of medical college teachers. Because if you are getting 3 lakh salary in a corporate hospital, nobody is going to go in for 1.2 lakhs or 1 lakh in a medical college and teach students. And they are going to go from 10 to 5 in AC environment and take that salary. So we need to promote medical education by giving medical teachers their due And if they are paid well, the ethical practices are there, the good environment is there. These are the two immediate measures. Rest, privatization, it is going on, so we can't help it. So on the other hand, we should strengthen our public medical colleges. So for that also we need money. So we need to invest in healthcare, whether it is medical education or it is public healthcare, until unless we need invest more, and that is substantiated, that is written by all the national health policies formed by the government since 22. So it is for last 20 years, government's own committees are propagating that we should spend more than 2.5% of GDP. Otherwise, our health system is going to collapse and privatization is going to take care. And what we have seen in COVID is exposure like never before.
I think this was a very nice solution.
If Dr. Agarwal wants to make any comment.
Thank
Dr.
you,
Agarwal.
Professor Dr.
There is one question in the chat box also.
Please ask that
And
question.
thank you for highlighting the deficiency in the present medical education setup. And there is a lot of infrastructure and medical power, shortage of medical power, manpower. So this is everywhere available, the same thing, whether it is a private medical college or in the government medical college. And what is the reason? Reason is because the increasing doctor-patient ratio. As the doctor-patient ratio is increasing, so the demand for the medical colleges are increasing. And government is putting up new medical colleges only to fulfill the deficiency of doctors, but not the quality of doctors are not increasing. So I think instead of going to
right.
deciding the
I think the main message that Dr. Vitull Gupta wants to give is that you have to strengthen the NMC, give it more powers, give it teeth, and give more budget for the medical education so that you can improve the healthcare. And also strengthen the
NMC as well as MCI, both are corrupt.
No, that's different. That's different.
And MCI is doing the same thing.
We cannot say
NMC is doing. MCI was doing the same thing.
Dr. Agarwal, we cannot say NMC is corrupt because we have got very respectable people there, but they have not been given the due powers and they are not taking action. As simple as that. I think we'll close it here. We'll close it here.
Even
there is no end to discussion.
Today's interns.
Dr. Agarwal, there is no end to discussion. We are running out of time. I like.
But Dr. Birmani, there is one chat box question. Can you allow?
The answer to that question is very simple. He's asking about NMC giving a regulation of bonds, but unless you give power to NMC, nothing can be done. So I think we'll close the session here.
Yeah.
And thank you, Dr. Vitull Gupta, for a wonderful talk. आपने जो आज बताया, it is the stark truth, the bare truth. The question is that all of us know it. पर्दे के पीछे क्या है सब जानते हैं. आज अपने पर्दा उठा दिया. ये courage बहुत कम लोगों में होता है. And I salute you for this courage. And I hope most of us also have this courage to point out the flaws, not only point out, but correct it. Thank you, Dr. Vitull Gupta, for a wonderful talk and raising these issues. Now we'll go to the next program, part of the program, and that's a scientific session. Number 1, nuances in management. And we have got 3